extent, I'm greatly honored to be asked to support you in whatever little way I can and as a bridge to what's happening in Pakistan. So, this particular group, the APPNA Pediatric group, has been quite active, both in people's individual capacities and also in collective capacities. And I'd like to praise the work done by several office bearers, Dr. Aisha, Dr. Khalid, and others in reaching out to pediatric primary care. And today you have two, again, wonderful individuals speaking to you. Nasir Mahmood, who will speak about his own foundation's work, and I'll not steal his thunder. And then my dear friend, Sajid Makbul, who has been a pioneer in so many things in pediatrics in Pakistan. So let me start by saying that these are very exciting times for public health in Pakistan, because just 4 days ago, the Interministerial Committee approved, after almost 2.5 years of work, the universal healthcare package of interventions. And these were spearheaded by a group of technical and academic individuals, but largely based on the widely acknowledged disease control priorities 3 cost-effective interventions. So my role in all of that was to ensure that we have all the essential pediatric and newborn interventions in there, and they are there now. And they are not only part of research, but they're actually now part of an agreed package of interventions that the government has formally approved, and not just the federal government, the interministerial committee across all provinces. If you don't know what this means, I will be happy to share with you, because this does mean now that we have no excuse not to have interventions such as resuscitation, appropriate respiratory management of newborns, appropriate mix of interventions for major killers in childhood. The other big advance that has happened this year is that we've completed our child, actually maternal, newborn, and child mortality survey in Pakistan with the cause of death ascertainment. So we are able to now compare what progress has been made or otherwise since 2005 when the last survey was done. And those results will also be available very soon. Now, these are very important in terms of guiding the government in progress and also in looking at the direction of travel. The third bit of information that I can share with you is that childhood immunization rates, despite COVID-19 and despite the deficit that was encountered in the immediate lockdown periods, first 2 months, have now gone back to base, which means that in many provinces, they are at least 80%. And in some, like Punjab, they're close to 90% in some districts. So that's very good news. I mean, we have our challenges with the polio control program, but that level of immunization coverage, if it can be achieved between provinces, would be a major stepping stone in Pakistan's quest to reduce child mortality. And there are exciting large-scale projects that at some stage I'll be happy to talk to you about, including the Umeed-e-Nau project that has registered a 25% reduction in neonatal mortality within 30 months in its target high-risk districts. So I don't want to say too much except to say that you have an enormous opportunity of joining many of your compatriots and people in outstanding work in the country to move the needle forward on essential interventions. You've just read yesterday, as I shared with you, the first evidence after the initial setback with a negative trial of antenatal corticosteroids in a rural district of Pakistan, Rahim Yar Khan, where it's led to a significant reduction in newborn mortality. So it's that kind of work that we need to ensure that we scale up. And with COVID-19 and with Nasir team's work, if we can increase the acute care quality and availability of oxygen, availability of monitoring systems, then some of the major bottlenecks of child mortality will be reduced. My last point relates to the areas that have not yet been covered in Pakistan, and two of those are now in our grasp. One is we have had for the first time as part of the National Nutrition Survey, which was launched last week, the first report on adolescent health and nutrition in the country. And that makes a lot of difference in terms of targeting both for the nutrition transition and also other health gaps. And the second is that we have just completed for the first time, a child health and nutrition survey amongst school-age children in Sindh and Punjab. The Punjab survey was completed 2 days ago, and the Sindh survey was completed about a month and a half ago. And the results now open the doors for many interventions, which may not be for survival, but for improving quality of health and care for many of these children, including vision screening and dental health, orodental hygiene. So, as pediatricians, we can be part of the journey or we can be observers on the sideline. I think APPNA Pediatrics has an enormous opportunity of being co-travelers with many people based in Pakistan, in rural districts, and in areas where they work now in an incredibly coordinated manner to address public health in the country. So I'm greatly honored to be able to provide you as a trustee some degree of support and guidance, and I'm at your beck and call. So thank you very much for the opportunity, and I wish you a fantastic meeting today, which I will join in a short while. I need to get my grandchildren home, and I will be hopefully listening in to what Nasir and Sajid Makbul and all of you have to say. Thank you.
Thank you, Dr. Bhutta. I look forward to having you back in a little bit. All right. So now moving on to the next meeting, the next on the agenda, what we would do is we're going to have our neonatal resuscitation program committee. It was founded by Dr. Riaz, and Dr. Misbah Qureshi has also played a big role in it. And today we have Dr. Nigat Mehdi, who's going to do a little presentation on that. And Dr. Mehdi is graduated from Fatma Jinnah Medical College in 1986, and she completed her pediatric training at Sir Gangaram Hospital and then worked as a junior registrar there until 1993, later moved to USA. And she did her pediatric residency at Texas Tech and then pediatric pulmonary and allergy fellowship at University of Iowa. Currently, she's serving as an associate professor of pediatrics and a cystic fibrosis center director at the University of Oklahoma. And she's also the president of FJ Fatma Jinnah alumni for 2019 and 2020. I look forward to hearing her speak. Dr. Nigat, are you here? I see her, but
We have stepped away.
she just stepped away. Yes, she is. She
No,
just
she's
checked
on mute.
She's
Is
done
she on-
mute.
Yeah, she said she's joining in a minute. Okay.
I think we will welcome Dr. Nahid Usmani and have her say some words. She is one of us, and we are very proud to have her. If Dr. Marine agrees to have her say some words, and we are very, very happy to have her among us.
Of course. Yes, while we wait for her, we can absolutely have Dr. Usmani. I'm so glad she was able to join in today. Um, as we all know, Dr. Usmani is a professor of pediatrics and hematology oncology at the University of Massachusetts. And she's also the current president of APPNA with 20 plus years of APPNA service and involvement. She has received numerous awards and accolades in her service to her profession, to APPNA, and as a leader of community. So we are very honored to have her join in today. Dr. Usmani, would you just say a few words, please?
Ji, Assalamu alaikum, everyone. Assalamu alaikum, Dr. Sajid Makbul. So good to see you. You're looking good. Thank you, Aisha Najib, President, APPNA Pediatrics, and all the fellow pediatricians on this forum. With a burgeoning young population in Pakistan, I think APPNA Pediatrics has a very essential role in making a deep impact and improvement of healthcare in the youngsters the young bulge that we have in Pakistan. And we can put in policies and we can put in interventions that will have long-term benefit for Pakistan. I think this is a wonderful group of volunteers who always on individual or collective level have served the pediatric populations in Pakistan. And I encourage and I promote any efforts that you have. If you have projects that you need approval, from Central APPNA. I am there for you. Pediatricians are very underrepresented world over, and certainly they're underrepresented in Pakistan. And I want to be, one of the voices for improvement of pediatric healthcare in Pakistan. So my best wishes for a very successful meeting today. I'm really excited to be a part of it. Thank you.
Thank you, Dr. Naid. It was really a pleasure having you here with us today. So now, let me see, Dr. Nigat is here. So Dr. Nigat, are you here?
Assalamu alaikum, everyone. Marine, can you put up my slides, please?
Yes, I am going to do that in a minute.
Thank you, everyone. I am humbled and honored to present as president of the Fatma Jinnah Alumni, our report for 2019. And I would like to, first of all, thank all of the organizers and APPNA Peds family, both here in USA and Pakistan, all the members who are here today for this meeting, for giving me the opportunity to present our report. So my special thanks to Central APPNA and President Dr. Naheed Usmani, past President Dr. Naseem Shekhani for his support to FJ alumni, APPNA Pediatrics Chair, NRP Committee and past President Dr. Mohammad Riaz, APPNA President Dr. Aisha Najib, APPNA Treasurer Dr. Khalid Kamal, Dr. Muhammad Amir Zaman Khan, RVC, Fatma Jinnah Medical University, Dr. Harun Hamid, Chairman, Pediatrics, Mayo Hospital, Dr. Leah Greenspan-Hodder, NRP Facilitator, Neonatologist, Global Health Expert, Chloe Hooper Holmes, MPH, Second Year Medical Student, University of Kansas, Dr. Amara Naeem, Assistant Professor of Pediatrics, Gangaram Hospital, Dr. Saima Chaudhary, Assistant Professor of Gynae and Obstetrics, Gangaram Hospital, and Dr. Shamim Malik, Neonatologist, St. Francis, Tulsa, Dr. Imran Awan, Neonatologist, Integris Baptist, and also my own university, Oklahoma University of Health Sciences, and especially our anesthesia department and my department too. So I would like to just add on a few other things. I think this conference that we had, an NRP, I basically was planning to do a conference, first medical conference there on request of Dr. Amir Zaman on my visit to FJMU in December 2018. As I had gone there with APPNA, and then I was invited for presentation for Shujaat Ali Memorial Lecture. At that time, Dr. Amir Zaman requested me to come back in 2019 with at least 8 to 10 alumni together and arrange an educational symposium on an annual basis. Thus, beginning 2019, and we started talking to my EC, and we developed a WhatsApp group of FJ alumni. Members were requested to consider joining for the December 2019 meeting. And in July 2019, actually, we invited Dr. Amir Zaman to come over as our invited speaker to APPNA meeting. Also at that time, Dr. Leah Greenspan-Hodder presented her global work on our last APPNA pediatric meeting. And Dr. Aisha Najib requested me and Dr. Amir Zaman that since the neonatal mortality in Pakistan was very high, it would be a good idea for her to visit us because she has global experience. And also I invited her to facilitate the NRP course, which we really needed as we did not have a formal NRP training. So based on some of the observations that Lee also did a little round and toured our hospital in Gangaram, labor room, delivery, ORs, and some of the observations which she had made, since we all go there, but we really don't go to each of the places. There were things that she mentioned which were like easy fix kind of things. And then there were long-term things that we are planning to improve. So I would say I appreciate Dr. Amir Zaman's support to our FJ alumni for this conference and appreciate his hospitality. And it really felt that we were loved, appreciated, supported, and FJMU still belongs to us. And our family on WhatsApp group has grown to FTA members. We are about 100 members, not all are APPNA members, but we are trying to recruit them and join APPNA. Our vice chancellor and few other faculty from Pakistan are also part of it. I would like to really thank Dr. Mohammad Riaz from the bottom of my heart. He was the main key person, along with Dr. Khalid Kamal, who really helped me to connect to in Pakistan to other people. So I got the support where the NRP dues were paid by the Mayo Hospital doctor. And then we also, Dr. Khalid Kamal bought a mannequin initially on behalf of APPNA Peds, but Fatma Jinnah alumni were able to raise funds and we were able to buy a mannequin.
Dr. Nigat.
Raise our funds and we were able to pay. I would really like to thank all of people were chosen by people in Pakistan. We wanted only 8 because 2 of us, me and Dr. Hiba, and my here, which was Helping Babies Funds, have already been trained. I am just showing some pictures of our symposiums that we were part of. And if you can go on with the pictures. So these were hand-on sessions. These trainings we supplied them an online curriculum from NRP by American Academy of Pediatrics, which they were supposed to have done and passed the first part 1, and then part 2 was conducted by APPNA Peds. And we are really thankful for Dr. Aisha Najib's vision and her connecting us as alumni with Fatma Jana, and we have signed an MOU and we hope to do more projects in the future. Helping Babies Breathe also had 8 participants. So uh, our plan was to go back this year, but because of COVID, we have not been able to. We wanted to make them this is just part of the conference that we did. I just wanted to show that those educational seminars were very well attended. And in the end, we had some fun too. We went to the Lahore Fort, which was sponsored by Fatma Jana. We also went to Wagah border. As you can see, we all had a lot of fun along with our American friends, Leah, and uh, we showed them the Wagah border too. So the meeting is really cool. I want to say whoever participates in educational stuff in Pakistan, as a group, it was a challenge for me. But again, we were able to successfully conduct a 3-day kind of educational thing with 1 day of NRP, Helping Babies Breathe, and then followed by 2 days of educational stuff and hands-on sessions, including career counseling, because we want all the FJ alumni to feel motivated to go forward in life. And we have improved some of the communication between the staff over there, like PEDS and OBGYN pediatricians now go and attend all the high-risk deliveries. We also have more infection control, keeping the baby warm. And also the last thing is we have established a kangaroo care room over there too. So Aisha, that was my conclusion thing. I think we have made some progress and inshallah we will keep on. And I really appreciate from the bottom of my heart all of the people who made it possible. Thank you.
Thank you very much, Dr. Nigat. That was a very wonderful presentation. Really enjoyed looking at the pictures and all the work that you all did there in Lahore. I would like to ask if Dr. Riaz is here, and as the chair of the NRP committee, if he has anything that he wants to share with us at this time.
Okay, assalamu alaikum everyone. Let me find my slides. This is my first experience sharing that. So let's see. Okay, can you guys see my slides?
Yes.
Okay. Okay, and you can hear me, everybody, right?
Yes.
Okay, great. So yeah, APPNA. Now we are calling it NRP Rollout Pakistan Project, but basically this was a neonatology project which we started a couple of years ago in 2015-16. And main motivation to start this project was that Pakistan has the highest neonatal mortality rate in the world. And our thought process for what we can do help with that. So as a group, couple of things we thought about doing at that time. One thing was to introduce Helping Babies Breathe program throughout Pakistan in every village, rural areas, towns, because all those dies and which delivers babies, a lot of those people who are there at the time of delivery, they are not the pediatrician, they are not the neonatologist who are there. Because resuscitation is only one part of the equation, there's a need to cut down the infection rate, there's a need to improve the breastfeeding, improve the kangaroo care. So we decided to work on all those issues together. Dr. Aisha took 3 months off and she stayed in Pakistan. She spent time meeting the government officials, ministers, secretaries, all the different professionals. And there were many conferences, meetings, and all those kind of things. There was a little progress made. I should say, Dr. Aisha can certify on that. But overall, we were kind of not very happy with the progress made in those times. So we decided to concentrate on what we can do ourselves. And that was to help with the NRP to the institution over there in Pakistan to establish their own programs over there. So, I mean, first we thought who we can collaborate in Pakistan, who has reach all over the Pakistan. So we thought of College of Physicians and Surgeons of Pakistan. They have offices all over and they are the strongest education institution in Pakistan. So we reached out to them and we were able to have a collaboration with them. And in 2016, we conducted 2 workshops over there in their Lahore office, and they were also very excited in the beginning. They have a news conference. They officially launched the newborn resuscitation programs, and everybody was there. All the leadership of CPSP and Dr. Sajid Chaudhry was there, who inaugurated that with them. And after that first 2 conferences, they wanted us to that we should work with AAP, so give them the copyrights. The way they do right now is that they do the BLS, ACLS, and ATLS, and AHA allows them to issue certificates in Lahore. So they wanted AAP to do the same thing, but we told them that AAP do not do that. AAP do not allow us to issue certificates outside the USA. And AAP encourages countries to establish their own programs. And we were there ready to help them to do that, but they backed off at that point. They say they don't want to do anything about NRP, and they still have not come forward with us to, cooperate with us on that, even after repeated efforts to engage them. So at that point, we decided to look some other avenues, and we came up with the idea that we should look at the other possibilities in Pakistan. We looked at Pakistan Pediatric Association, but PPA in Pakistan is not well organized like AAP in USA. So they were not be able to run an NRP program in our view. So we decided to go with the institutions in Pakistan. And just briefly giving back a history of NRP in Pakistan. It's not a new concept in Pakistan. Dr. Mubarak Naqvi, who is here with us in the meeting also, and just recently retired from Texas Tech. He has been going to Pakistan since 80s and teaching NRP, and many other of you also have been there teaching NRP. But our vision was not to teach NRP, but to establish NRP programs in the institutions. And with collaboration of AAP, we plan to have the program similarly like we have the program in USA institutions. So those, they will have their accounts, they will issue the certificates, and they will keep the records and database over there. So since there is no central body, we decided to reach out to each institution and ask them to have a program under their name. So our first breakthrough came when King Edward Medical University, Professor Lake agreed to cooperate with us, and he got all the approvals from the university. It took about a year, and after a year, we have our first workshop, 3 days workshops over there, where we trained the NRP providers, we trained the instructors, we provide them all the equipment, everything over there to set up their NRP program, and they are continue to teach now. They have 6 hospitals affiliated with KEMU, and they're teaching the nurses, the doctors, and other people who attend the deliveries over there. So when we were there, we got a big support from all the pediatric community in Lahore. We can see Dr. Sajid Makbul is here in this picture. Masoud Sadiq, he's the dean of Children's Hospital, other professors. Dr. Harun Hamad is, which is on the left side, he is the current chair of the pediatrics over there, who is running this program at this time. We also have a great collaboration with Pakistani Army over there. The neonatologists, few of them in Pakistan, they have shown great interest to teach NRP to the Army hospitals. First, Dr. Aisha Najib, she conducted workshops in 2018, and Dr. Misbah Qureshi, he's a neonatologist from Virginia. He also travels every year to Pakistan. In 2019, he trained 40 providers in CMH, Muzaffarabad, Azad Kashmir. I also traveled last year and I conducted 4 workshops in MH Rawalpindi and trained over 100 providers. We have been pushing them that they should establish their own NRP programs, like what's are called in Rawalpindi, their medical university, they have nuns. But they have been reluctant to do that at the top military leadership. Anyway, even they do not have their like NRP program by a name, but we have trained instructors among Army neonatology group, and they are conducting the NRP workshops over there. So this is an ongoing program over there, and we help them whatever we can to continue with this. Last year also, we also signed an MOU with Peshawar Medical College, and we conducted 3 workshops there and trained 12 providers and 2 instructors. My vision is to keep less people during my training workshops. So I can concentrate more on training those instructors who will be continue the program after we leave on that. Actually, I have to mention over here because Dr. Mubarak Naqvi was planning to travel with me, and he traveled all the way from Texas to Chicago, but missed his flight. He was very upset about that. So I really thankful for all the efforts he did to join me in Pakistan to conduct these workshops. And he has been always very supportive of all the work we are doing in Pakistan. Thank you, Dr. Mubarak Naqvi, for that. So I'm just showing you 1 or 2 pictures of the workshops over there.
Thank you, Dr. Riaz.
Sure. And the people who attended, Dr. John is, I think, one of them over here. He's a senior pediatrician in Peshawar who came also to see me in Peshawar. The next MOU which we signed was with the Indus Hospital, and Dr. Misbah Qureshi, who is also the class fellow of Dr. Bari, who is the CEO of Indus Hospital. He was the one who was the main instrumental in this project. He has been traveling to Pakistan for many years, and he is very dedicated in teaching NRP and has trained hundreds of providers in Pakistan. So this year, then we signed the MOU, and he helped them go and establish the NRP program there. So he trained the instructors, they have the equipment, they have their own account with Health Stream now, where they can buy the instructor courses and provider exams. So Dr. Qureshi traveled actually 2 times in 2019, January and September, and again in February 2020, just before the COVID hit us. And he trained 12 instructors and 160 NRP provider. That's amazing. That the work he has been doing for the NRP promotion in Pakistan. So some pictures from Dr. Misbah. You can see Dr. Misbah in the he wears the scrubs when he goes NRP training, because his philosophy is that people should be ready whenever even they are training NRP. So Dr. Misbah over here with the other staff in AKU. Our future plans are, we already have signed MOU with 3 institutions, Jinnah Medical University, Sheikh Zayed Ramyar Khan, and Aga Khan University. So this year is different for Aga Khan University because this is not going to be NRP just teaching. Dr. Shabina, I think many of you know Dr. Shabina Arif. She worked like 2 years almost working with the Aga Khan University education department and all the way to administration to getting up an approval to establish an AKU NRP program. So the program will be administered by the AKU. They will be issuing the certificates and keeping the records. And hopefully we are hoping that they will be helping us to reach out to other places in Pakistan. Like certainly we need to reach out to Hyderabad. We need to reach out to Quetta, we Multan, Bahawalpur, other cities, smaller cities, wherever you can. So if we have established this program now we will have 2 centers in Karachi, 2 centers in Lahore after we establish program at Jinnah, 1 in Peshawar. Rawalpindi is another area we are trying to get somebody to take a lead, because we cannot do unless there are dedicated people, volunteers who want to run the programs in Pakistan. So hopefully we can find more people over there. We have 4 accounts right now established in Pakistan, which we can use to buy the courses for the people who want to participate in this. And with the help of everybody, I was thankful actually to everybody who was with me, Dr. Aisha, Dr. Khalid Kamal, and all the executive committee of APPNA Peds, and many other volunteers who have helped me throughout this course. Thank you very much. Okay, Assalamu alaikum. Thank you, Dr. Mahreen. I'm done.
Thank you, Dr. Riaz. So moving along, next we will have a little discussion about APPNA Merit, which was actually created by and chaired by Dr. Nahid Osmani, and she was for 5 years. The goal was to improve the medical education in Pakistan. So we have today joining us Dr. Danish Bhatti, co-chair of APPNA Merit Committee. He's an associate professor of neurology at University of Nebraska Medical Center, and he's also the director of International Neurology Program and co-director Parkinson's Disease Program. He is now directing the APPNA Merit Family Practice Specialty Rotations, a program for general physicians here. So I invite him to tell us more all about the APPNA Merit program. Dr. Bhatti, are you here?
Thank you so much, Dr. Mehreen. I would like to acknowledge and thank Professor Nahid Usmani for introducing me to this role for the first time when she called me and connected me with Dr. Shahid. Dr. Shahid Rafiq is the chair of APPNA Merit, and I'm presenting on behalf of his excellent work. And I also want to thank Dr. Aisha Najib, who for the very first time introduced me with Kemkana, and I found me from nowhere and a completely unknown person. So I'm really thankful for having 2 of my mentors here in bringing me where I am. So APPNA Merit, let me present 3 aspects of APPNA Merit. Number 1, what is our current version of APPNA Merit? Number 2, what are we currently doing? And number 3, how can we support your group in work in education in Pakistan? So the vision of APPNA Merit is to develop structured, organized, curriculum-based, short and long courses to offer in form of blended learning at all levels. We are currently heavily focused on continuing medical education. So physicians who are in practice in various fields, general practice, neurology, nephrology, pulmonary critical care, so on and so forth. We are trying to develop short courses and long courses, which are skill-based. They're organized and structured. So the process is very different. These are not just one-off webinars. We come up with a project on what we want to do. We have a vision for it. We put together a team for it. They develop a curriculum. We find local partners in Pakistan at all level, institutional, in the local societies. We do a lot of brainstorming to discuss what the program should look like, what should be the objectives of the program, and how should it be achieved. And then we finally put it together. So this is a very different approach than a traditional webinar approach where you just do one-off session based on who's available and who's the speaker. But these are goal oriented and goal targeted kind of designing of a program, and very designed courses. We have done many, and we're doing many of these courses. We have created an online learning management system called APPNA Academy, which will be hosting all of this content to provide access to our learners. The current flagship program we're doing is a program on family practice specialty rotations for general practitioners in Pakistan. The goal is that there are over 100,000 GPs in Pakistan who do not have any residency training. So we want to see if we can provide some kind of a educational experience which matches or parallels a family medicine residency. So they're not going to leave their practice and go into a family medicine residency. So what we want to do is to provide them rotations through cardiology, neurology, pediatrics, emergency medicine, and so on and so forth, so that they kind of have a virtual experience or training of being in a family medicine program and improve their practice. So we are doing cardiology rotation right now. We have neurology rotation coming up. We have over 600 applications from general practitioners to join this course. The course is certified by, we have a CME from University of Nebraska Medical Center, Center for Continuing Education. So this is AMA category 1 CME that is being offered for this course. They get 1 hour of CME every week for a live session, and 2 hours CME every week for online assignments and quizzes and different tasks that they have to complete, which is all built within the learning management system. We are taking small cohort on each rotation for this registered course, but the sessions are open. So the last live session that I attended yesterday morning, we had 157 GPs who were attending our 90-minute session on ventricular arrhythmias in cardiology. And there's more details I can give based on interest, but we're doing many such other programs. We have a mini fellowship in movement disorders for neurologists that I run. We have just launched a mini fellowship in stroke for neurologists. We have 20 neurologists enrolled in that course that Dr. Shahid Rafiq is running. We just launched a webinar series on emergency medicine, and we'll be working on developing a short course on emergency medicine with our partners. And we have very extensive partnership in Pakistan. We work with the Surgeon General's office, with the DG Medicine and DG Surgery for Army Medical Corps. We work with the VC offices for KE, for PIMS, Sazabist in RMU, and with NUMS, National Institute of Medical Sciences. And then we have many society partners locally. And we, of course, have been in contact with CPSP about family medicine for the last 6 months now, with Dr. Shoaib Shafi as the acting president of CPSP, and Dr. Khalid Masood Gundal in the counselor. And then the DG Medicine of Army also holds a position on the council in CPSP. And then lastly, what I want to say is that the way we can help support you guys for any educational activity is by offering coordination for educational program, educational courses, by offering a coordinator. We have now 2 education coordinators based in Pakistan who are helping put together these courses. We have an online learning management system. We have Zoom platform access with webinar accounts that we can help with. And we need your help in the pediatric rotation for the general practitioners. I just did a survey to ask what would they like to see as their next rotation after neurology. And the second highest vote were for pediatrics. The first highest was acute emergency medicine. So these 2 will be our next priority to conduct after neurology as a 3rd and 4th rotation. Thank you so much for your time, and I'm happy to answer any questions.
Thank you, Dr. Bhatti. Sorry, I'm just going to do some housekeeping cleaning. Does anyone have any questions for Dr. Bhatti? As I believe he has to leave us shortly.
I have a question for Dr. Bhatti. Danish, thank you for all the excellent work you're doing. This is Dr. Aisha Najib. what are your expectations from our APPNA pediatric members? We have a lot of specialists and subspecialists. So what would you like to have? How would you like us to participate?
Thank you, Aisha. So the way each rotation is done, we develop a team of 3 experts from that subject as the team lead. One of them is from UK, one of them is from Australia, and one of them is from US. Those 3 people work together to take input from other experts to develop a curriculum for their rotation. And then once a curriculum has been designed by them, they start inviting speakers. Speakers, so far, we have decided that all of the speakers will be from US because this is APPNA Merit program. So we have a panelist from UK, and we have a panelist from Australia, and 2 panelists from Pakistan in every single session. But all the speakers on those curriculum are US based speakers decided by the team lead of that project. And so the goal or the request would be for someone to be assigned as the team lead for pediatric rotation to help start developing the curriculum. And then once the curriculum is designed, to help select or invite speakers for those live sessions. We are typically limiting the maximum number of weeks for any rotation as 8, so that we can cover many specialties over a 1-year period. So we need 6 to 8 weeks of a curriculum in pediatrics under a team lead, and then that team lead to invite a group of people as speakers and of course as panelists, in addition to our collaborators from UK, Australia, and Pakistan.
Danish, it would be good to also mention that besides the lectures that are being given, there is a weekly task related to the topic that the participant has to complete to show comprehension and understanding of the subject.
That's right, Dr. Naid. We give them additional reading material. We give them MCQs, 3 to 5 multiple choice questions, and we give them an assignment to complete. Plus, we can give them additional video or audio resources to watch. All of this can be hosted on Canvas that they have to do. So they have a weekly engagement of additional 2 to 4 hours in addition to the live 90-minute session.
Marine?
I think Dr. Humaira Kamer has volunteered, so we can discuss this further in our meetings. Maybe we can have her lead the program and develop a curriculum, and all of us, anyone who wants to volunteer can reach out to one of us and we will send the information. Thank you, Danish.
Thank you very much. So next, moving along, we will, sorry, I think, we'll have Dr. Nasiruddin Mahmood, who will be giving us a little update and a little introduction to Child Life Foundation. So Dr. Nasir graduated from Aga Khan University in 1988 and did his residency in pediatrics from Penn State, Hershey, and then fellowship in neonatology from Sick Kids Hospital, Toronto. He's a pediatric faculty at AKU since 1994 and is a founding trustee of Child Life Foundation, and he serves on several non-profit boards. And is also the adjunct faculty at the University of Toronto. Dr. Nasir, please welcome and
Assalamu alaikum. And thank you, Marine, and the rest of the APPNA Peds team for giving me the opportunity. At the outset, I have to recognize my 2 teachers who are present on the forum, Professor Zulfikar Bhutta and Professor Sajid Maqbool. They've been great teachers, advisors, and mentors. And whatever I'm trying to do is a little humble effort to basically advance their mission for the children of Pakistan. I'm just going to go into the screen sharing mode. Hopefully this will work very smoothly. And Marine, please confirm if you can see my screen.
yes, we can.
All right, so I have promised Marine that I'm going to wrap up within 10 minutes. So pardon me for breezing through the slides, and inshallah, we will get an opportunity to answer questions. I'm quickly going to go through the story of the Child Life Foundation. Many of you are already aware of it. Dr. Sanjay Gupta of CNN visited Pakistan in 2010 during the floods and reported on the state of emergency care at one of our emergency rooms in Karachi. And this is a screenshot from that clip, which is still present in the CNN website archives. And that emergency room is in the back. And this is what he saw. This is the emergency room at Civil Hospital, Karachi at Dow Medical College, 2010. The resuscitation trolley in the background. Waiting area. This is what triggered the formation of the Child Life Foundation. It was something that had to be done. And a couple of business community friends of mine, Iqbal Adamji, Zohair Zakaria, we got together and decided to upgrade this emergency room. And this changed in 13 months into this. We now have a network of, alhamdulillah, 10 emergency rooms in the public sector in Pakistan. And our approach has been that we create the infrastructure in the public sector environment only. And in addition to the infrastructure, we provide critical life-saving equipment. This is our resus room at NICH. We have a fully stocked pharmacy, which provides all inotropes, adenosine, anti-snake venom, anti-rabies, whatever is required. I would like to proudly say that not a single, well, maybe 99.9% of the cases never ever have to go out to purchase or acquire a medicine now. We have automated our systems completely. We established a very efficient triage system in all our emergency rooms. We had a locally developed EMR, which is now functioning beautifully after many versions. We did some very simple things. This is the biggest request from the physicians, that we cannot work when people are looking over our shoulders and are putting pressure on us for care. This is the crowd at the registration desk at the NICH. And it required a very simple thing to do. We just put in the ticket system. This is what it looks like today. We have had to hire human resource. Equipment and infrastructure alone does not do it. We now have 153 physicians on our payroll. We have 12 qualified FCPS pediatricians or MRCPCH pediatricians. 42 of these 153 doctors who work in our emergency rooms are DCH or MCPS in pediatrics. We have hired 249 nurses and 101 pharmacists, which basically is a new concept in these emergency room pharmacy stores. Every emergency room that we have, all 10 of them, have nearly 100 staff members on our payroll. We extensively focus on training them. Of the 390 clinical staff on our payroll, the doctors and the nurses, 94% are BLS certified, 87% are PAL certified. These are AHA programs. We do not give them the AHA certificate because it costs more than 10,000 rupees each, but we use the materials of the AHA. And we have a very unique pediatric emergency medicine certificate course, which is an 18-week course run in collaboration with Dow University. So far, 230 physicians have been certified in pediatric emergency care. Remember, pediatric emergency medicine at this time is not a certified, not a recognized specialty for training in Pakistan. We also have a 2 to 3 week pediatric emergency medicine certification course for nurses because infrastructure alone was not good enough. We had to have human resource, which is qualified. And one of the most unique aspects of our work is the trained pharmacists. We have a trained pharmacist, a diploma in pharmacy at all our shifts in all our emergency rooms 24/7. And they are contributing amazingly. They pick up one prescription error every hour. Because so much data has been collected, we do publish research. Our teams regularly go to the Emirati Emergency Medicine Conference in Dubai, and this is 2017, 2019. We have had 49 abstracts accepted. Our first paper in BMJ has been published. Remember, we are not a university and we're not an academic department. Monitoring quality is essential. We have this monitoring dashboard right from janitorial to security to maintenance. We monitor the performance, the KPIs that we have defined for each category. The physicians are audited regularly based on 3 principles of competency, compliance, and compassion, and their trend in performance is monitored over the quarters. Clinical case reviews are performed by the emergency room hospitals in each of their capacity, their domains, and feedback is given and performance is monitored regularly. This is again a dashboard for the pharmacy whereby prescription errors are logged in, adverse drug reactions are logged in, accountability for our supply chain is also done. The names of the abbreviations of the hospital emergency room are in the first column, which is civil hospital and ICH, Sakhar. This is an antibiotic audit by our pharmacists, and this is basically inappropriate use of antibiotics prescribed by our residents. So pushback comes from the doctors, from the pharmacists then. Pharmacists are told not to prescribe, not to dispense any antibiotic or any medicine unless there's a diagnosis written in the EMR. And that was the biggest challenge for us. The young doctors were very reluctant to commit themselves to a specific diagnosis. And it took us a long while to let them to do that. And the only way we were able to do that was that the medicine will not be dispensed unless you commit yourself to a diagnosis. This is the team. I mean, this is the people who are really doing the thing. Dr. Ahsan Rabbani is our CEO. He's done an amazing job, mashallah. We have finance, supply chain, operations, human resource, donor relationships. Dr. Irfan Habib is now the director of our clinical operations. He has done basically amazing work. Almost every person who's been trained in our teams has been trained by Dr. Irfan Habib himself. We have international partnerships because we wanted to make sure that if we are doing good work or reasonably good work, then how is the world looking at us? In the first 2 years, we had an affiliation with, well, not an affiliation, a partnership with the Stanford University Emergency Medicine Department for setting up our initial quality standards. We are now working with William Osler Health Systems in Canada, where we are working towards achieving Accreditation Canada standards. Inshallah, the first 2 emergency rooms in public sector in Pakistan, pediatric emergency rooms, will inshallah achieve the Accreditation Canada certification, inshallah, by next year. We have reached a level of 89 points. They get certification at 92. We lost points for not having ID bands. And technical collaboration, Johns Hopkins Emergency Medicine, we have a very nice mentorship program, both with Johns Hopkins, and I should have mentioned University of Maryland, because Dr. Adnan Bhutta and Dr. Junaid Razak are basically instrumental in establishing this. Our first cycle is ending in spring of 2021. We are hoping that this will continue. Sick Kids Toronto Emergency Department helped us in establishing our point of care ultrasound training. This is the Accreditation Canada team who were visiting us just before the COVID. Our end customer is the patient, the poorest and the sickest of Pakistan. We have a very robust patient satisfaction model whereby a text message is sent to every patient who is seen in our emergency rooms, and a yes, no answer is received and collated. This is some of the data summary of our patient satisfaction survey. So what has been the real impact of doing all this? Alhamdulillah, we have served more than 3.1 million patients in the last 10 years. This year we are celebrating our 10th anniversary. For the critically ill children, the priority 1 WHO ETAT criteria patients, our survival rates have really jumped. And since the last 5 to 6 years, we have been hovering around 90% survival for P1 category. You will see a little bit of a dip in the last quarter. And the reason that is happening is because we started 3 emergency rooms in Quetta, Sakhar, and Jamshoro. And because of COVID, our connections with them and our monitoring got a little compromised. But inshallah, we will be able to pick this up. And this is what I'm really excited about nowadays. This is our head office at the telemedicine unit. We are now moving to a state-of-the-art dedicated center on top of our emergency room at Civil Hospital Karachi. So all our emergency rooms are connected to this. We provide virtual consults. This is a doctor in Ghotki. And we do, so when they need help, they call us. We, on an hourly basis, do virtual rounds. Our cameras are amazing resolution. We can actually look at the lines of your hand by zooming in. So this doctor can zoom in and pan and give feedback to the duty doctor over there. ET tube might be out, she picks it up. This bubble CPAP is not bubbling, she can pick it up. So, alhamdulillah, we have a network of 10 emergency rooms. Every public sector teaching hospital in the province of Sindh now has a child life ER. In addition, the Civil Hospital Quetta has a child life ER. But this is what I'm most excited about, our hub and spoke model. These are our emergency rooms, and we are now linking them with telemedicine and DHQs in the district hospital headquarter office hospitals. We don't own those emergency rooms, we don't run those emergency rooms, but we have a system of connecting them to their nearest emergency room for constant telemedicine care and to the head office in Karachi. We have, you can see the time distance for travel from these DHQs to these emergency rooms. And this is what we still have to do, at least in Sindh. In Karachi, our aim was that every sick child, however poor, should be able to reach an international standard emergency room within 30 minutes. And this is a footprint of all our ERs. Money matters. Where does the money come from? So we have 10 emergency rooms, 5 in Karachi, 4 in the other cities of Sindh, and 1 in Balochistan now. The cost for running 1 emergency room for us in Karachi is about $1 million US every year. This is raised from private philanthropy. 70% is raised in Pakistan, 30% in North America. The 4 emergency rooms in Sindh are completely funded by the Sindh government. And the 1 in Quetta is completely funded by the Balochistan government. Amongst our donors, we have the community of Pakistanis in Houston, who have sponsored this research room, Austin, Texas, Fresno, South Florida, Fresno again, and what are our future plans? We have covered Sindh, we have covered Quetta. The rest of Pakistan is awaiting our work. Just before the COVID started, we had agreed upon the MOU for PIMS in Islamabad, but then Wuhan happened and COVID happened and everything has gone on a back burner. We are hoping, inshallah, in early 2021, we will proceed and have our child life emergency room at Children's Hospital Islamabad, inshallah. This still remains the ground reality for most of Pakistan. Children are giving positive pressure ventilation, often by their own relatives. But good things can happen. Thank you.
Thank you very much, Dr. Nasir. This is impressive work indeed. Doc, I have Dr. Humaira Qamar here who wants to ask a question. Dr. Qamar, if you may unmute yourself.
Assalamu alaikum, everyone. This is an amazing program. Thank you very much for inviting me. I have a question about the child life. First of all, I want to appreciate this amazing work that's being done. I'm so impressed. I cannot tell you. And inshallah, next time I visit, I will visit them. My question is, I just saw your last slide showed that you will be moving to other parts of the country. So I'm very interested in finding out, you know, there's a children's hospital in Lahore also, and then King Edward and Fatma Jinnah, like Nighat said, and then Allama Iqbal, and several private medical schools also need children's ER, because this has been traditionally an area which is neglected. What are your plans? I know COVID, you just explained, has kind of put everything back in the back burner, but will you guys be expanding into Lahore soon? Thank you.
Thank you for your kind words, Dr. Humaira. We have, for the lack of a better word, struggled to make any inroads with the Punjab government. We have made several attempts, and we have only one request from their leadership. And Professor Sajid Maqbool is here, and he's also tried to help us in that. We just want them to come and see our work in Sindh. That's all we want them to do. Aake ek dafa dekh le. And then, you know, the whole thing will roll then. Because as soon as you enter these emergency rooms, you realize that the paradigm has shifted. And it is very, very important that they need to come and see it for themselves. And that is, we have been sending invitations, and we have used our maximum highest office connections to try and achieve that. But sometimes it becomes very difficult for people to go into another province and see work in another political domain. Maybe that's the reason. I don't know the answer. But we basically decided to then bypass Lahore. We tried to do Lahore, and we bypassed Lahore, and we started focusing with the federal government, because PIMS comes under the federal government. And we had a lot of support from there. And hopefully it will happen. But if today people from any part of Pakistan are willing to come and see the work and understand what is happening, we are ready to go. Absolutely. I mean, like, absolutely.
Thank you so much. I
Yeah.
really appreciate your very comprehensive presentation. I appreciate it.
Thank you. I have Dr. Bhutta here who has a question.
So Nasir, I'm actually quite surprised to hear this. And you haven't discussed this with me before, because I would have recommended 2-3 things. Firstly, I would have put you together with Yasmin pretty rapidly, and some of her folks in the primary care program. I'm sure they would be very receptive. I mean, as you know, our outreach to many individual districts in Punjab, particularly southern Punjab, have been received with nothing but open arms. So, you know, we have projects in Raim Yar Khan and in Sadkabad and other places, and they've all been very successful. So I suggest offline, maybe send a summary and I'll connect you to Yasmin. But the other thing that I wanted to suggest was there is a very strong philanthropic sector in Punjab with particularly the industrialists, and many of these people belong to the Chinioti Baradri. I mean, they pour in a hell of a lot of money into their own initiatives, small initiatives, reach out to people. And sometimes the way to get to policy makers is also through them. So Punjab, there is a reasonable network of private sector hospitals or trust hospitals. And there is nothing that moves the needle more than an exemplar within some of those trust hospitals as well. So I'm sure you can make inroads. But the last point that I would say is that Punjab is not homogenous, as many of people on this forum know. We used to think that southern Punjab is probably the worst off. It's actually, from the recent data that we've analyzed, it's actually central Punjab that's been left behind, because a lot of investment has gone to southern Punjab, but central Punjab, many of those districts in terms of indicators are lagging behind. So you may want to work with some of the legislators from those particular areas, and you know, principally short circuit this, because as you know, Bari works in Punjab, and there is always a way of getting into some of those policy frameworks, maybe through local legislators. Over.
We'll be very happy to reach out to Dr. Yasmin Rashid again, and I mean, anything that moves the needle forward.
Nasir, this is Mahmood Kichi. I just wanted to tell you that we are getting ready to get people together to raise some funds in Houston, and I will reach out to you in that regard. And I think I can reach out to you through the WhatsApp number that you have probably. And so we also need some names of the people that you may know in Houston that I can contact to like get a group together to raise funds.
Absolutely.
Thank you so much. Thank you very much.
We'll just have Dr. Lubna Naeem ask a quick question, and after that, if we could hold off for the questions so that we can have a keynote speaker, please. Thank you.
Well, thank you so much. I'm really impressed with all the good work that is happening, and I had the opportunity to visit Child Life, and it had come a long way. What a spectacular work is being done. Thank you for all your contributions. My suggestion or my recommendation or question is there any way APPNA can help bridge that gap in taking this initiative to other parts of Pakistan? And how can we do that?
Yeah, so thank you, Dr. Lubna, for your kind words. I think for us now, we have evolved into 2 dimensions. One is our core emergency rooms, the standard emergency rooms. And the second, which I think is even more impactful, is to leverage off the technology and use telemedicine. So I think if we can create, with the help of Professor Sajid and Professor Bhutta and the rest of the team, and if we can create one flagship emergency room in Punjab anywhere, and then create the hub and spoke model around that and create those telemedicine centers. It's not very expensive to set up, and the operational, it's $20,000 to do a telemedicine center a year in any district. And, APPNA can, as a pilot, aim to work with us to establish one such unit somewhere in Pakistan. And then things will take their own pace, and things will happen in their own way, because once we have confidence, once we have gone through the learning curve, working with each other and working with the government, everything is possible. Pakistan, the biggest challenge really is to just get together and move the ball. And, nothing succeeds like success. Once people see that this is possible in this district, they want it in this. We have to create the flagship.
All right. Thank you very much, Dr. Nasir.
Thank you.
And now we're moving forward. I am extremely honored to have with us Dr. Sajid Makbul, who's Professor Emeritus of Pediatrics at Children's Hospital Lahore and Chairman Board of Members of the same institution. He's also have been a professor of pediatrics at Sheikh Zayed Hospital, and also prior to that at KE and Mayo Hospital as Associate Professor of Pediatrics. He has been an editor of textbooks of pediatrics, infectious diseases, handbooks of neonatology. He's been past president of Pakistan Pediatric Association, and currently is the chief editor of Pakistan Pediatric Journal. He's involved in teaching and training of pediatrics, and has been a great teacher and mentor for all those interested in pediatrics in Pakistan. And many of us who are here, he has been a mentor for all of us. I'm greatly honored to have you here, sir.
Thank you very much. Can you hear me?
Yes.
Can you hear me? Okay. Now let me try and share the screen and see. Yes, here we go. Can you see my screen there?
Yes, we can.
Okay. So first of all, let me thank Dr. Aisha, Dr. Khalid, Dr. Mehreen, and also acknowledge the presence of some of my friends, Dr. Zulfikar Bhutta, Nasir, of course, Muwariz Naqvi, Dr. Mubin Rathore, and others that I may have missed. I was a little surprised at having been asked to speak on this occasion. And my mind went back to the time when, as one of the founding members of APPNA way back in the 70s in Detroit, I probably in my wildest dreams could not imagine that some years down the road, I will be talking to a very distinguished group of pediatricians who belong to APPNA, because at that time, even APPNA didn't have more than a handful of members. So it's very gratifying. Fortunately, since you are very enlightened, most of you, and very aware of what is going on, what I have to say is perhaps repetition, perhaps a reminder of the state of affairs in Pakistan, and some of the suggestions that I have actually been implemented by some of you already. So let me just begin by reminding you that I am going to be talking about the current situation in Pakistan and a little comparison with where you are presently and what is the possible role of APPNA or beyond what you've been doing. And a reminder, of course, that this is, of course, the world of the map of the world as we saw it in school with its normal proportions. But if you were to look at it from the child mortality perspective, of course, this is flawed. And there are areas of the world which have a disproportionate share. which of course is a reflection of the work that Zulfikar Bhutta along with others had done way back a number of years. Of course, at that time, there were perhaps 10 million deaths, and now, fortunately, we're down to 6 million. But the fact remains that this is the area where we have most morbidity and mortality. And amongst the mortality, let me re-emphasize the fact that it is the first month of life that, of course, is the most important. And those of us who have traveled this road together, Zulfikar Bhutta will remember that it has taken us many, many years for drawing attention to this particular fact, and that is to focus on this particular period. And we have, of course, had some success. Also, a reminder that the causes of infant mortality in Pakistan are quite different compared to those in the United States. And we still struggle with infectious diseases. Of course, pneumonia being the number one. The only difference has been that diarrhea is no longer the number one killer of children under 5. And of course, the lion's share is still taken by 3 conditions in the first month of life, which is prematurity, birth asphyxia, and neonatal sepsis. Now, compare that to the country that you are presently living in, and you'll see a stark difference. Perhaps the picture that we have here now may be what you saw in the United States about 100 years back. But look at the causes of death in those under 5, and you will see a totally different pattern. And of course, I don't have to tell you that when you consider infections, etc., they're way down on number 6 or number 7 when it comes to between 5 years and 9 years. And we have, of course, over the last few years, seen a remarkable increase in homicide and unintentional injuries, even in children. And I'm told that both a combination of the COVID situation as well as the onslaught of the information technology has increased these numbers in North America. Now, a reminder that a very significant role is played by malnutrition within the context of morbidity and mortality in Pakistan. And if you obviously are malnourished, you have not only a greater chance of being sick, but the severity of sickness and the chance of mortality is increased. This becomes very important because we have a very high percentage of stunting. And this is from the survey from 2018. And as Dr. Bhutta alluded to, we have seen some progress. We have seen progress in almost all provinces, and perhaps the most significant difference has been in the province of Khyber Pakhtunkhwa. So the trend is downwards, but the fact remains that we're still at a very high level of malnutrition, perhaps 40% nationwide. And what is worse is the status of young girls, adolescents especially, where maybe 50% of them may be anemic. Of course, this has implications for pregnancy, for childbirth, for the health of the neonate, which is where we need to concentrate. Now, Pakistan, fortunately, is a signatory to the SDGs, and as compared to the MDGs, this is a more holistic sort of an approach. And you don't necessarily only need to concentrate on health, and it shows the importance of what is called taking care of the community as a whole. So we have the environment, we have the social factors, we have living conditions, etc. And that is why from the 17 goals that they have, only one of them relates to health. That is, of course, not to say that is not important, but that the emphasis is that this is part of a comprehensive approach. And of course, the basic premise is that besides the government's responsibility, the civil society and the private sector do also pitch in. So with that sort of a picture, of the status of health of children in Pakistan, which is far from optimal and not where we want it to be. The question that you probably want to ask is, and you probably have answers to this already, is how can APPNA help? Now, the answer is not very difficult. Of course, finances, we've heard just now. I must admire the spirit, the commitment and the dedication and the continued support that Pakistan gets, the population of Pakistan, especially the children of Pakistan and the neonates of Pakistan get, despite the fact that you have other obligations and other commitments. So yes, you can support it financially. An example was just presented by Dr. Nasir Mahmood, and he does get financial support, a significant financial support from the United States, although the bulk comes from Pakistan. You can help in two particular areas, and you are helping actually. One is education, which at times I feel over the years is more important than health. Of course, the two are linked, and education, especially of girls and of girls who are then going to be responsible mothers and therefore be able to take care of their lives better and take care of the children that they're going to produce over a period of so many years. So in education, there are a number of institutions within the country that are doing a wonderful work. And I thought I might want to sort of point this out to you because there must be some of you in the US or Canada who may just want to sit there and try and help without being actively involved. So these are just few examples. The Citizens Foundation is one of them and doing a remarkably good job. And like all good things and like all good people, I believe, who come always from Karachi, and you have two prime examples right there. The TCF also started from the province of Sindh, from Karachi actually, but look at where it is spread, and it has now 1,652 schools nationwide. And these will provide education to those who are underprivileged, those who don't have opportunities, who do not have the finances or the means to get quality education. So for those of you who are interested in sort of sitting there and helping out, and in the field of health, for example, our own Professor Abdul Ghaffar Billu, also from Karachi, has been at it since 1979 and has been involved in not only education and health, but also in water, sanitation, hygiene, shelter, livelihood. It's sort of very comprehensive. And you have to sort of meet him to realize the kind of work that he and his team are doing in so many villages, which is actually most of it in Sindh, but nevertheless, it is helping a lot of people there. So in the field of health, you can work at different levels, I think. You can be an advisory, and you have heard Dr. Zulfikar Bhutta advising the government. And of course, this is very helpful because when people from other countries with experience, wealth of experience and knowledge and original research come to them, depending on who is sitting in the government, they generally do listen. And I might point out here that Dr. Nasir might well try one more time. The Minister of Health in Punjab may be more receptive to the wonderful work that he's doing. And of course, we'd be very interested in making another effort to get this across in the province here. I might mention that collaboration does exist, and the Behria Foundation has recently upgraded the Children's Hospital emergency room in Lahore. So it's not that they are not willing, it's just that there might have been some bureaucratic hurdles that that we need to overcome. I think in examples that have been put forth, the merit, for example, and the NRP are good examples of training and teaching, and also of monitoring and evaluation, especially the merit program, as I have just been told. And the use of telemedicine, the fine example of Dr. Nasir Mahmood taking the this science to the periphery is what I would suggest. So not only should APPNA be involved in teaching and training and provide guidance to teachers or trainers, it should also, and not only limit themselves to tertiary care centers like King Edward Medical College in Lahore or the Dow Medical University in Karachi, but also develop linkages with the rural setups, the districts, the talukas, the periphery. This is where it needs to be done. Something along the line that Nasir Mahmood has just explained to you, and that is these linkages are very, very important, because some of the population is not either able or at times not willing to come to a larger center or a larger town. And it involves not only expenditure, but also involves distances. It also involves permission, and therefore linkages through APPNA with training in these areas or actual service-oriented approaches in these areas would be very, very welcome. And I'm glad that this is being done. Now, when Dr. Aisha asked me to give a talk, she'd actually asked me to talk about my personal experiences. And I thought my personal experiences would not be as interesting. But nevertheless, I am from a generation which has seen with some satisfaction the evolution of pediatrics. Dr. Zulfikar Bhutta can attest to that, and of course, Nasir is the recipient of that evolution. We started in pediatrics at a time when it was not even accepted as a separate discipline. And so if the internist, who was very wise and all-knowing, he decided that he was a pediatrician also, he took the dose for adults and just halved it and said, well, this is what pediatrics is. And so unfortunately, I started from there and started from there, and then had the satisfaction of seeing establishment of designated pediatric units all across the country, of children's hospitals, and now we have one, at least one or more than one in every province. And then the development of pediatric subspecialties. Now it is mentioned here that emergency pediatrics is not a recognized specialty, but consider other specialties that we've been able to get on board: neonatology, pulmonology, intensive care, cardiology, GI, nephrology, pulmonology. And Nasir, we are actually in the process of getting emergency care also recognized both by the college and by the various universities. So we have training programs in these. In the year 2000, we used to send all our pediatric cardiac patients to India. Now in the year 2020, we have pediatric cardiologists across all provinces, and they have training centers. They're doing cardiac surgery right here. So these are satisfying developments. But I think the most important has been the relevance of preventive health and the recognition, the acceptance of the importance of it, I think is one of the best things that has happened. The importance of taking care of problems not after they occur, but before, or anticipating and taking care of young girls, especially their health, their education, their welfare, and the recognition that this is how we can improve not only their health, but also the health of the children who will follow. So despite all the difficulties and all the problems and all the setbacks, I would still not trade my place with anybody else. Of course, this is just a personal opinion. I have had a very satisfying experience working in Pakistan. I've had the pleasure of meeting some very distinguished people, and two of them, at least two of them I can see right now, Dr. Zulfikar Bhutta and Nasir within your group. Of course, the wonderful work that all of you are doing within APPNA, I have been able to associate with. So the future, as far as I'm concerned, is bright. We have been able to identify the problems within child health, and we have come to solutions. And just as you heard that we are embarking upon a universal health card or insurance, which is a dream come true for most of us. We have the necessary political will at the present time. We probably have the finances, and if not, we can procure them. And with coordinated efforts, I think the only way we're going to move forward is to succeed and improve the lot of the children in Pakistan. So, zara nam ho to ye matti bahut zarkhez hai saki. I have great hopes and I have great admiration for all of you who are willing to join in our efforts to improve child health and child care in Pakistan. With those remarks, I thank you once again for having given me the opportunity. You don't quite know what a pleasure it is to meet all of you and to interact with you and get an opportunity to host you. I hope when you keep coming to Lahore, just inform us and we'd be delighted to participate in all your endeavors. Thank you once again.
Thank you very much, Dr. Sajid Mahmood. It was indeed a pleasure to have you here. I have Dr. Bhutta, who has a question or a comment for you, please.
So I wanted to commend Sajid for many things that he did not say. And since he has been a partner in crime over the last several decades, I will say them because he did not. Professor Sajid Maqbool was instrumental, along with some of us, but his support was invaluable in getting some of the postgraduate training programs and the fellowship programs established in the country, of which neonatal pediatrics was a big one. And at the time when he was in a leadership position, getting some of those positions established in rural districts was also something that benefited greatly from his vision and his support. So the country and pediatricians, Pediatric Association owes him a tremendous debt of gratitude. And of course, I have personally benefited from his friendship with the last 3 decades. But I will say one thing to APPNA colleagues, which I think is really necessary, which is closer dialogue between APPNA and the Pakistan Pediatric Association. And I say that with great sincerity because I think that dialogue could be improved and could also be strengthened, not on an individual basis, but on an institutional basis. So we have a major pediatric congress, I believe, coming, which is a hybrid congress at the end of November in the cities of Quetta. And there will be some people joining virtually, some people will be there in person. That's an example. But there's absolutely no reason why there cannot be joint APPNA and PPA sessions. And the advantage of doing that is that you will improve, you will lift everybody up. You will improve the standard of pediatrics by closer collaboration between the two organizations in a more systematic manner. And it also then opens the door for many side specialty discussions and meetings in subspecialty areas that are increasing in Pakistan all the time. Just take it from me that someone who sees this over time, that there is tremendous change, tremendous improvement. And as Sajid said, Khyber Pakhtunkhwa as a province is a remarkable example where things have changed far better than many other places, irrespective of money. So it's also a question of how you invest money. It's also a forward-looking province which has put in a universal health coverage package. Very few people know that as we speak, every family in Khyber Pakhtunkhwa is eligible for state support of 1 million rupees a year. I mean, how many countries are able to do that? Outside of Mexico, there's not a single example. Look at how people are struggling in this country, in the United States, in terms of just getting a basic modicum of universal health coverage. So those things are not well advertised, but they are remarkable examples of progress in the middle of a lot of trouble. If one message, and Sajid, you may want to opine on this, is that APPNA Peds should probably, while it does many of the other things at individual level or contacts, probably enter into some kind of an agreement with PPA that at every large major regional and national and international meeting that PPA holds, there ought to be some sessions which should be joint APPNA and PPA sessions. I'm sure there'll be a lot of receptivity to it.
Absolutely, Zulfikar, a wonderful idea. And again, one of the advantages of interacting with people like Dr. Aisha and others, Dr. Khalid Kamal and others, is that we can explore potential. Just like the child health over a period of so many years, the Pakistan Pediatric Association is also improved. I think collaboration between the two is very natural and normal. And I would, if you allow me, I will take it upon myself to suggest that we get participation of APPNA in this particular meeting. At least some of you can join some of the sessions, because although some of us will be there physically in Quetta to support them, but so many of us distinguished speakers will be, of course, online, and you can certainly participate, and we can then raise it in the Central Executive Committee, and from here on, we will have collaboration. I'd be happy if Aisha or somebody else from your group would want to join me in trying to establish this. I will certainly use any influence that I have in the association.
Yes, thank you so much. So this is a great idea. We have been trying for like 7 or 8 years to impress upon the Pakistani pediatricians that how important it is to have a very highly organized association in the form of PPA, just like the American Academy of Pediatrics, and what they can achieve together is most important. So Aisha and Riaz, Dr. Riaz Saab and I all have tried to connect with them, just to be go back a little bit back and to talk with the institutions. But through our Facebook page, which has 4,500 members right now, which are Pakistani pediatricians connected together globally. It's in UK, US, Pakistan, throughout Pakistan, from Gilgit to Thar. We have connections. So every time we give a message of unity, solidarity, and to come together in a very important, robust organization which can achieve more in terms of political pressure, child welfare, and more organizations like Child Life, and all the good efforts. Because ultimately it's the community level, and we follow the principles laid by Dr. Zulfikar Bhutta and yourselves, that the community pediatrics is the most important thing that we have to focus on. Thank you.
Just wanted to comment on Professor Sajid's presentation. Sir, I was really, your last slide, the evolution slide, was very profound in the sense that it gives, that's the benefit of having people like you with esteemed background to come and share your wisdom, because it gives us perspective. And the one thing that, the thing that stood out from that one slide was that in order to make headway in Pakistan, you need to be patient, you need to be able to be perseverant, and you need to be programmatic. because if you are able to do all of those things, then programs come in place, subspecialties kick in, pediatrics becomes a specialization, and I think that's one thing that I'm going to try and remember, because it does require a lot of sabr to do things, and inshallah. But thank you for your wisdom and sharing it with us.
You actually need a dinosaur to remind you. But I mean, I think it's made my life very rich because of this particular experience, moving from nothing to where we are. And therefore, sometimes when we get very disappointed and very upset at the lack of progress in in many fields in pediatrics or child health, one sort of needs to sit back and say, okay, wait a minute, this is where we started from. And this is where we have come. And just like what Zulfikar was saying, it's not all bad. We have, if we can push this universal health insurance or card for the entire country, this is what we're talking about. We recently had a meeting where all the ministers of health of all the provinces were there, including Gilgit-Baltistan, Azad Jammu Kashmir, just I think 3 days back, and were discussing and spoke very positively about getting this all across the country. Now, this is remarkable. I mean, we are moving in the right direction. All you need to do, like, many times people ask me, what have you done? And I tell them, I may not have succeeded, but I can assure you I have tried. And this is what it is. All you need to do is keep trying, keep at it. So if with, for example, the PPA or with all the other institutions, with NRP or everything, if you have not succeeded, or emergency medicine, please don't give up. And if there is anything I can do, of course, now I'm at a situation where I can influence some of these people a lot better than I used to be able to. Certainly will help in these endeavors. So I look at it from optimism. I think things are going to get better with all these programs in place.
Well, of course, Sajid, you should mention that we knock and criticize so many things, particularly when we are afar. But the fact that Pakistan was able to launch an absolutely phenomenal COVID response, I mean, I've just been reviewing and writing about this because I've been working with them, is remarkable. And it could not have happened without some fundamentals being right. Just look at how the country was able to launch through Sania Nishtar one of the most remarkable mitigation strategies for the poorest of the poor. Even India could not do this. Despite all of its resources, I mean, they messed it up in such a big way. They're paying the price for it now. So jaisa bhi tha, I mean, Pakistan was able to do it. Secondly, we were able to keep numbers down. People talk about data. I've seen the data in and out, and there is no excess mortality of the kind that other countries have experienced. So some things went right. On stunting, I didn't tell you this, but we've analyzed based on I just launched the National Nutrition Survey report 4 days ago. We've analyzed at a subnational level what has changed between 2011 and 18, and the districts, the provinces that have done well in terms of reducing stunting are actually Khyber Pakhtunkhwa and parts of Punjab. That's why I was saying central Punjab was left behind, because northern Punjab and southern Punjab did reasonably well. And they did it with limited resources, and some other provinces did not do as well. And that's where data-driven policies come in. My one final comment that I would make, Sajid, you may want to comment on this also, is बड़ा ज़रूरी है, क्योंकि अपना पीड्स की हम बात कर रहे हैं, कि जब आप जाएं पीडियाट्रिशियन से बात करने के लिए, so talk to them about partnerships. ये ना जाके कहें कि जी हम आपको आके कुछ सिखाएंगे, because people who are on the ground, as Mubarak knows also, he's been coming for several decades, they're working very hard, and they sometimes know the ground reality is much better than people who come from outside once or twice a year. So it is important to reach out, but it's important to reach out as as equals and partners, rather than going and saying you don't know anything and we are here to teach you. So when you discuss this with PPA, please ensure that you put forward a partnership model in which there is bi-directional learning and also a camaraderie that is put together, rather than a condescending kind of an arrangement. Over.
I agree with you, Zulfikar, totally. It's not only to do with the Pakistani diaspora in North America or elsewhere. It's just that sometimes, when we have discussions, there are people within the country who feel that they are the ones who know how to handle the local situation better than anybody else coming from outside. And they may not be entirely wrong, because we have been wronged in the past also, where we have been given programs that were not really catered to the peculiar situation that we have. So I agree with you totally. If you come and tell them that you want to talk with them, share with them, and partner with them, it seems to work better than coming and telling, well, listen, this is the way it is, and that's what I've come here to sort of tell you. So, I mean, it's sort of also have to keep in mind the appreciation of the kind of work that they are doing despite tremendous odds, Nasir knows this. You go to the periphery, you talk to a pediatrician who works in Sheikhupura, just about 40 miles from here, and he has to see 100 or 200 children in a day. So what do you expect him to do? You think he's going to do, a detailed physical exam or take a detailed history, and he's got a limited number of medicines that he can dish out. So what you have to do is understand the local situation. Same thing with the Pakistan Pediatric Association. I can use my influence or whatever to bring the two together, because I think this will work better for them. For that is the local pediatricians, family physicians, and that's a very important group. And also, bring you a lot more mileage than you can get without this sort of.
Very good to see you, Dr. Sajid Makbul and Dr. Bhutta. I remember those days, earlier days, when we used to work together in different hospitals. I was so thankful to Dr. Bhutta for letting me come and participate in Aga Khan University Hospital, and also Dr. Sajid Makbul at the Children's Hospital of Lahore. Very, very nice to see you. It encourages me that I can still connect with you through Zoom. Thank you so much, and I would love to help in any which way. Teaching mainly, that's my passion, and I would like to help in there. And thank you so much, Dr. Sajid Makbul and Dr. Bhutta.
हम तो सिर्फ बातें करते हैं, असल काम तो आप करते हैं। तो वहाँ पे आते हैं और सिखाते हैं, समझाते हैं, शामिल होते हैं और सब अपने खर्चे पे करते हैं। आपने तो बहुत काम किया हुआ है। इसी तरह नसीर हैं, जुल्फ़िकार हैं, खालिद हैं, आयशा हैं, बाकियों को मैं इतनी अच्छी तरह जानता नहीं हूँ, मुबीन हैं। ये बहुत अच्छा काम हो रहा है, बहुत अच्छा काम कर रहे हैं और आप शामिल भी रहते हैं और शामिल रहिएगा, हमें छोड़िएगा नहीं। मैं शायद ना हूँ, मगर ये है कि बाकी तो यहाँ चलता रहेगा ना काम। तो हर एक को अपना काम करना है। रियाज साहब बहुत काम कर रहे हैं और उनसे पिछली मरतबा मुलाकात भी हुई थी। अभी वो भी इन्वॉल्व रही हैं। तो हम समझते हैं कि इकट्ठे मिलके हम बेहतरी ला सकते हैं। दो ही प्रॉब्लम, आप तो अमेरिका में कहते हैं ना, if you're not a part of the solution, then you're a part of the problem. So I certainly don't want to be a part of the problem. I want to be a part of the solution, and of course आप हमारे लिए ज़्यादा बेहतर सॉल्व कर सकते हैं। इकट्ठे मिलके हम बेहतर काम कर सकते हैं। बहुत शुक्रिया।
और वो डॉक्टर रियाज, आई एम थैंकफुल टू यू टू, ही टुक द लीड. जब बहुत पहले वी मेट इन अ मीटिंग इन सैन डिएगो and we decided that we should start teaching NRP, and I think he took the lead, and then Dr. Aisha Najib and all those people. And thank you so very much, and all the best wishes from my side for Dr. Bhutta and Dr. Sajid.
Can I just make a comment regarding NRP? I think I'm not very up to date with it right now, but I think Professor Sajid might have more up to date information. The National Neonatology Group of the Pakistan Pediatric Association has been very proactive, at least for the last, I think, 15, 20 years. And, we have conducted workshops together. And maybe if you guys can focus on that part of PPA, the National Neonatology Group, and talk to them and see if because they are focused on developing master trainers,
right.
And that's where the real impact is. So that's one suggestion. For Child Life Foundation, our immediate next need, and maybe APPNA through some way can help us and guide us, is not actually NRP, because we're not working in the labor room, but actually neonatal advanced life support. So that's an area which we are planning to start in 2021. And any suggestions, you can manage it. You can reach out to me through chat, and we can talk about it. Thank you.
And Nasir, maybe I can pitch in here. So, the problem has been.
Can I call you back?
The problem has been that there is a local version of the resuscitation program, which is sort of worked on by Dr. Irfan in Lahore from Children's Hospital. And he has, of course, with collaboration of British neonatologists, he's been able to get it registered. It's called NEO-LIS, or Neonatal Life Support. And it's sort of more basic than the American NRP, or the North American Neonatal Resuscitation Program. And as we speak, they have conducted something like more than 200 of these courses all over the country, including in Balochistan and in KP. So work is being done now. Some of these people do collaborate, and Aisha, I think, can attest to that. Some don't. And despite my very best efforts, the last time Aisha was there, we did not succeed in a very good collaboration. But the fact remains, and I believe that no matter how you work this out, I think this program needs to continue. I think the other program needs to continue. There is no harm, because ultimately the benefit, it goes to those who are going to be looking after these deliveries and neonates. So yes, it's not to say, we started this neonatal program, and if Zulfikar remembers, once he and I he had me fly with him to Sri Lanka to train nurses and neonatologists in Sri Lanka. That's one of my most memorable trips, because you went in, you slept the night, you did the course, came back to the airport, and flew back to Karachi and then to Lahore. Zulfikar, do you remember that? Are you around or not?
I absolutely do.
And this was way back. I think it was the early 90s when we did this.
Yeah, and we got support, if you remember, Sajid, from UNICEF for this. So there is no shortage of resources also that one can have in this area. But what I would say is resuscitation is one thing, and lots of people are now trained in resuscitation. But what we may benefit from is a lot of aftercare training and management of babies, because I haven't yet spoken about what the recent mortality survey showed. It still shows that there is a significant morbidity associated with asphyxia, and post-asphyxial management is very poor in many places. So we need to plug the gaps, the evidence gaps around what needs to be done. Also, a lot of work on infection prevention and management in those facilities. Nasir, I have to sign off to take a flight back to Toronto now, but one thing that you may want to focus on is what can you capitalize on this post-COVID rebuilding in Pakistan in terms of improving your pediatric emergency management, and maybe to some extent pediatric critical care, at least in the district headquarter hospitals. I mean, the government realizes now that not having sufficient infrastructure for acute management has been one of the bottlenecks, was one of the bottlenecks in the early stages. वो ventilators के बहाने at least oxygen systems have been improved, and if nothing else, CPAP systems may come in. So you may want to look at that, because they would benefit from your expertise in terms of improving this. And my last point on this is, the survey shows that there's an enormous amount of accidents and injuries, which are a cause of mortality between 5 to 15 years of age in Pakistan. So there is also the need to plug that gap somehow in terms of improved quality of care. But I want to thank you all. Fantastic. It's a great session. I thought I may not be able to attend, but it's been a very great learning experience. Sajid, I'll talk to you separately. I'll give you a call next week.
Very good to see you, Dr. Bhutta. You remember the PEMAN program?
I do. There's now an Umeed and I'll again look forward to connecting with you, Mubarak. Khuda Hafiz.
Inshallah. Khuda Hafiz.
Thank you, Dr. Bhutta. I will answer Dr. Nasir's question about other programs. We have no problem with other programs. Actually, the first one we started in 2015. I went to Lahore Children's Hospital, met Dr. Irfan Khaja. And he told us what they were doing about helping babies breathe throughout Pakistan. And we for 1 year, we were collaborating with them. We were kind of planning a research study in Kasur with Dr. Irfan Khaja. And then after Dr. Aisha's work in Lahore, Punjab Health Department told us they don't need any studies. They're sold of implementing helping babies breathe in Pakistan. So for us was helping babies breathe, and all those programs, which the new basic programs are, we cannot go to the district level, and we can't do that. So at that point, we just decided to focus that what we can do is we can do the NRPs at the teaching institution levels. So that's what we are doing. Is basically those programs need to be done all over the country, and to get to train everyone. And any kind of training, I mean, certainly like Dr. Syed Makul said also, it's not only resuscitation, we have the other two infection prematurity, the other two killers. They need to be addressed also. So inshallah, we'll keep working. I think it's almost 1 o'clock. Let's see. Let's get back to Dr. Marine.
Thank you.
Very good to see you. Oh, sorry.
Marine, this is Mobeen Rathor. Can I make a comment, please?
Yes, of course.
Thank you so much. This is a terrific. I mean, it's so lovely to see APPNA Peds, growing into a very substantial organization and better organized and better governance than our parent organization. With all due apologies to everybody, we are all in this together. It's so wonderful to see my teacher, Dr. Makbul. It's always a pleasure to have him. He always gives us great wisdom. So I'll make some comments. Some of them, many of you on the call are not going to like, and Aisha, and those of you who know me, I hope would understand that they come from my heart. I don't have any issues around it. First thing is, I think we are APPNA, and we are from Pakistan. I love Pakistan. I go there. Dr. Makbul can probably tell you, every time I'm there, I spend a lot of time at some volunteer programs at the medical schools, whatever I can do. And I continue to do it through COVID on webinars, everything. But I think we also need to be very sure that we are pragmatic and realistic. There are issues, as Dr. Makbul has said, in Pakistan. And the first thing is we probably need to find good partners. And I find PPA governance depends on who's the president. When Sajid Saab was the president, it was a difference. So it's not like as one of my teachers taught me that, when you make an embroidery, every leader comes that keeps on keeping that embroidery going on or that painting going on. But it's very different every time. I've had the honor and privilege of speaking at that conference for many years, and you can tell. So I think perhaps there is an opportunity through Dr. Sajid Makbul and other leaders in Pakistan to maybe help PPA in the governance. We can have them help tell them how governance process. As you said, we can learn a lot from them, but this is one part that is unfortunately very weak. I've had the privilege of going to Thailand and China and all over the world in very poor countries also, where it seems the national organizations are quite well structured. So I think that's one part. In some fashion, we have to work on that. The conferences are terrific, but I can also tell you, having gone all over the world, you travel on your own expense to attend a conference, and you get 30 minutes to speak on a topic that is not good enough time. And I've said that many times. And then it has happened to me that they said, oh, somebody else has to speak, and so we can't give you time. But that's okay. It's not about me. I'm just telling you those sorts of things. So that governance is going to be an extremely important thing. And I'm really delighted we're doing this NRP program, such, because as many of you know, I'm always talking about, we don't need to buy these expensive equipment. We need to make these big buildings. We need to work on what's important. And Riaz and others who have done this, and Aisha, that is terrific. Doing it, what is getting, transferring knowledge and starting this program that doesn't cost a lot, probably much less than an echo machine or an MRI. And so I think my